Adverse childhood experiences, commonly called ACEs, can have lasting health impacts. Children who are subjected to abuse, violence, deprivation, hunger, or other traumatic experiences can carry the scars with them over a lifetime. 62% of Washington adults report one or more adverse childhood experiences. We know that the more ACEs a person experiences, the greater his or her risk is for alcoholism, teen pregnancy, poverty, cancer, divorce, HIV infection, mental illness, and many other conditions. That's why Clark County Public Health, the Public Health Advisory Council, and other organizations in Clark County are working to prevent ACEs, promote awareness of the problem, and find community solutions. The earlier we can address ACEs in individuals, the better our chances are of promoting healing and resilience. Assessing the work that's currently being done in our community to improve the lives of children and families is an important first step. Public health staff recently spoke with representatives of several organizations in Clark County to create a local perspective on ACEs.
When I first learned about the ACEs study, I thought about my own early childhood experience. I grew up in the 50s and the 60s with a single parent, and that just was unheard of in the neighborhood that I grew up in. And I realized the thing that made the difference for me was the fact that I had a mom, a grandmother, and a great-grandmother who were always there for me. It didn't matter how much money we had, it didn't matter what was going on in our life, that they were there to love and support me no matter what. And I think that's what every child deserves.
This is important for me personally, and I feel fortunate that I have learned about this topic because I have a 14-month-old baby, and I will try my very best so that he is not exposed to any of these risk factors. But if he is exposed, I will hopefully give him the tools so that he can build resilience.
In particular, we work with youth in the community who are struggling with childhood trauma. We give them opportunity to get involved with our community service work that we do. And most importantly, we have them work alongside other volunteers in the community that just come into these projects because they feel it's the right thing to do and they want to make a difference.
I've seen the burdens that these kids have grown up with, and I've also seen them blossom. Given an opportunity to learn and live up to their potential, to have other adults who care about them and believe in them, help show them resources and maybe push them a little bit. It's really been quite remarkable.
We're all part of the same community. We can separate ourselves, and we can take the approach that simply says that this space, these earnings, these achievements are mine and mine alone, and those deficits and those traumas and those challenges are theirs and theirs alone. But the reality is that our community is built in so many layers and so many networks, and what benefits one will benefit everyone.
Resilience is about the ability to stand in times of challenge and bounce back when overwhelmed. We can't shield families from stress or crisis, but we can give them the tools they need to respond effectively so crises don't escalate. We can promote good partnering skills and provide positive environments that help individuals cope when things get difficult. Adverse childhood experiences impact everyone, directly or indirectly. That's why finding community solutions and promoting resilience is a public health priority.